Kegel exercises are not just for women. While they are often associated with women's health, particularly post-pregnancy, men can also reap significant benefits from these simple yet effective exercises. These simple exercises can significantly benefit men's health too, by strengthening the pelvic floor muscles. Strengthening these muscles can lead to improved bladder control, better bowel function, and enhanced sexual performance. These muscles, located between your pubic bone and tailbone, play a vital role in bladder control, bowel function, and even sexual performance. When these muscles are weak, it can lead to issues such as incontinence and reduced sexual satisfaction. A strong pelvic floor can help prevent embarrassing accidents like urine leaks, especially as you age. This is particularly important for older men who may experience a natural weakening of these muscles over time. For younger men, strong pelvic floor muscles can contribute to a more satisfying sexual experience. Improved muscle tone in this area can lead to better erections and increased control during intercourse, enhancing overall sexual health and confidence. Kegels are discreet and can be done anywhere, making them an easy addition to your daily routine. Whether you're sitting at your desk, driving, or even watching TV, you can perform these exercises without anyone noticing. Incorporating Kegels into your daily life can lead to long-term health benefits and improved quality of life. Before you begin Kegels, it's crucial to identify the correct muscles. This step is essential for ensuring that you are targeting the right area and getting the most benefit from your exercises. Imagine you are trying to stop yourself from passing gas. Squeeze the muscles you would use. This action helps you locate the pelvic floor muscles, which are the ones you need to strengthen. Those are your pelvic floor muscles. They play a crucial role in bladder control and sexual health. Another way to find them is to imagine you are trying to stop the flow of urine midstream. This technique can be very effective in helping you identify the right muscles. However, don't make a habit of doing Kegels while urinating, as it can be counterproductive. Regularly stopping your urine flow can lead to incomplete emptying of the bladder and other urinary issues. Once you've identified the muscles, you can start doing Kegels in various positions: sitting, standing, or even lying down. Practicing in different positions can help you strengthen the muscles more effectively. Choose whichever position you find most comfortable. Consistency is key, so find a routine that works for you and stick with it. Now that you've found your pelvic floor muscles, it's time to exercise them. Tighten these muscles, hold the contraction for a few seconds, and then release. You should feel a lifting sensation when you contract the muscles. It's important to isolate the pelvic floor muscles. Avoid squeezing your glutes, thighs, or abdominal muscles. Focus on a controlled squeeze and release. Breathe normally throughout the exercise, don't hold your breath. Section 4. Building your routine sets, reps, and consistency. In this section, we will delve into the importance of structuring your Kegel exercises with the right sets and repetitions, and how maintaining consistency can lead to significant improvements in your pelvic floor strength. Start with holding each Kegel contraction for 3 to 5 seconds, ensuring that you are engaging the correct muscles. It's crucial to focus on the pelvic floor muscles and avoid using other muscles like the abdomen, thighs, or buttocks. Follow each contraction with a relaxation period of equal length. This allows the muscles to recover and prepare for the next contraction, which is essential for building endurance and strength over time. Aim for 10 to 15 repetitions in each set, and try to complete 3 sets a day. This routine helps in gradually building up the strength and endurance of your pelvic floor muscles. As your pelvic floor muscles get stronger, you can gradually increase the hold time and the number of repetitions. This progressive overload is key to continued improvement and muscle growth. You might start with 3 to 5 seconds, but over time, aim to hold each contraction for up to 10 seconds. Similarly, increase the number of repetitions as your strength improves. Consistency is key when it comes to Kegel exercises. Regular practice ensures that the muscles remain strong and functional, which can help in preventing issues like incontinence and improving overall pelvic health. Just like any other muscle, the pelvic floor needs regular exercise to stay strong. Skipping sessions can lead to a loss of progress, so it's important to make these exercises a non-negotiable part of your routine. Make Kegels a part of your daily routine, whether it's during your morning routine while watching TV, or even during your commute. The key is to integrate them seamlessly into your day. By doing so, you'll start reaping the benefits, such as improved bladder control, enhanced sexual health, and a stronger core. Remember, The effort you put in today will pay off in the long run. Section 5. Patience and progress. When to expect results. You might not see results overnight, but with consistent practice, you should start noticing improvements within a few weeks to a couple of months. You may experience better bladder control, improved sexual function, and increased confidence. Remember, everyone's body is different and results may vary. If you have any pre-existing medical conditions, consult your doctor before starting any new exercise program. Keep at it, and you'll be well on your way to a stronger, healthier pelvic floor.